All right, I guess it's noon. Good afternoon, everyone. Welcome to our weekly Facebook Live telecon, BTC, whatever you want to call it. Thank you for being here. I have with me today one of my trusted advisors on our leadership team here. I'll introduce him in a moment, but I just want to take a minute to say thank you to all of you who are working so hard out there, particularly those that I don't get to see who are teleworking. A lot of great work is still going on. Also to our folks who are out in the system who are part of the healthcare industry. We have a lot of people who are medical providers who are doing great work every day in the civilian community. Dr. Marte being one of them, as well as many of our people who are traditional reservists. Also to those of you who are out there who are doing frontline work in law enforcement, some of the other things that we do, emergency medical technicians, firefighters, all of you who are doing great work out there keeping the country running and keeping things some sense of normalcy. I appreciate what you do, and we have a great number of people who are involved in those things. So a couple of things are going on. First of all, you'll see I've got a new mask. I know that Major Marte and I were talking earlier. He has a little bit of mask envy because mine looks sharper than his. But, hopefully, as you're out there and wondering what to do, these are things that can be relatively easily constructed. I got mine from Master Sergeant Hillary Ornat's mother. Her name is Nancy Harder. She made this and provided it for me. And on the back side is just an old piece of ABU uniform, so it can be reversed and it works well for what it's designed to do. So I appreciate that, and those of you who are trying to do those things. I will tell you that yesterday afternoon, the LRS, Major Pizzola, in conjunction with contracting and FM, were able to order about 1,000 cloth masks that are reusable that should be here shortly. We're trying to also get some of the individual equipment issue cloth masks, face coverings that we can use as well, and we will be handing those out to people in order of priority. We're going to first get them to our defenders at the gate. We'll get them into the hands of our operators who are close quartered in aircrew situations, to our maintainers, and then to the rest of the population as we can. We did receive, I think today, our thermometers for the infrared thermometers for the testing of temperatures at the gate. As you can imagine, supplies coming in and out have been delayed, and so we thought we would get that done earlier this week, but because of delays in shipping, we just received those. So tomorrow morning, as you come into base early, you may see the test run of that. We've already kind of run through some initial exercises to see how we would do that. They'll be taking your temperature. You don't have to worry. It's not going to be something that contacts you. Our folks will be in protective gear. It may look a little bit like out of a moon landing, but nonetheless, they're just protecting. We don't have any known threats here on the base, but we want to isolate and make sure that people who are coming on, particularly in this next couple of weeks, that they're healthy and that we don't expose people unnecessarily. So you'll see that starting in the morning just for a test, and then it'll probably, depending on how it goes, we'll initiate a 12-hour shift beginning Monday. Other things that are going on, flights are continuing. We're continuing to maintain our operations to keep minimally proficient with our operators. Our maintainers are doing well. Our airplanes are healthy. We have our tenant units are robust. If you can imagine, you hear the news, the National Guard, and particularly here in this area, they've mobilized a lot of people to help out with the COVID-19 operations around the nation, and particularly downstate. They're doing great work, and we're doing everything we can to support them, and we appreciate all that they're doing out there. As well as our own folks. I sent out a link, and it's on our website, of one of our own individuals that we got out quickly last weekend, who's down in the tri-state area working with COVID-19 patients in the New York City area at hospitals there. And we also have ongoing requests for forces and information for possible plans to deploy more people, mobilize more people out there as we can. We're working hard to try and figure out how to get our deployers home. That's number one on my mind, and we're working every day to see if we can clarify those policies and make sure that they and their families feel that they're being heard and they have accurate information. As far as what we do here daily, I have a trusted team of my leadership. We discuss every day, at the end of the day, current operations and current conditions and anything coming down from higher headquarters. I don't think I've ever felt more connected with my leadership team than I do now. very seldom as a commander do I get to talk to my TR commanders and key staff on a daily basis. So early on it was identified that we needed to bring in a capability of somebody who could be my public health emergency officer as we start to look at public health emergency declaration, changing health protection conditions. Thankfully, we had somebody on our staff who's been trained in disease pathology, who is a physician on the outside, both he and his wife, and who also is an instructor at the University of Buffalo. So Dr. Erlen Marte, Major Erlen Marte, is that person for our staff. He's on orders for a period of time now, and he's available every day, and he's my advisor. So I wanted to just let you introduce yourself, if you wouldn't mind.
Thank you, sir. So, as Colonel Larson was saying, I'm a physician in the community. I'm actually an endocrinologist in the community, and I also teach the medical students as well as the residents in the community as well. My wife is also a physician working in the community. On base, I'm one of the flight surgeons, the SGH, and I'm also the field public health emergency officer. And here it's been great working with Colonel Larson and with all of you as well. Every time I get your questions and concerns, it's always good to touch base and to keep them coming. So thank you.
So one of the things we've been talking about is as we look ahead, we want to be, as a team, we don't necessarily want to always be reactive. We do react to emerging situations. We want to be proactive, but yet we don't want to be overreactive either. So as we've looked out as to what would be the next steps and what we would do as things may get worse here, we've come up with some ideas and some plans on where we would go. If we had to go to HPCon Delta, which we're not there yet, or if we had to declare a public health emergency, what we would do, and what kind of things in the community might trigger us to do those things or to consider those things. And what we look at right now, I think I can probably share with you, is we're looking at the number of cases daily in the local area. Dr. Marte is dialed in with the CDC and all the local health agencies and gets a pretty good read on where we are as far as hospital occupancy, number of reported cases, number of deaths, and we monitor that daily and get a report from him. We've set kind of a trigger level of where we might start considering, depending on the load in the hospitals, as to how we would restrict operations to the base if we needed to. And then of course we track the daily progress of the virus. So he's been a great help for me and a great person to rely on his expertise. So those are the things that are happening here right now. We're still, as I announced last week, we had one of our service members pass away, Sergeant Vogler. We're still working on trying to determine the cause, and we're working on returning him back home to us, and we are certainly still thinking about his family and wish them well and pray for their comfort and recovery. All right, so do we have any questions that we wanted to talk about? One of the ones that I saw come up before we get into yours, a lot of people are asking questions about things like even something as simple as our arts and our civilians who are not being able to take leave right now. They're building up these massive amounts of leave, and of course we know in the military if you don't use it, you lose it. So I just sent up a request, and I think they're discussing above my level, can we waive some of those things? Can we allow people to carry over more leave than they normally are as a result of not being able to take it? Or are we expecting once this thing kind of gets past us that we're all going to take leave for the last 3 months of the year? And that's obviously not an option. So those kinds of things are being looked at, deployers and how we get them home, some of the requirements for possible medical ground personnel in the future, as well as our air evac medics and nurses. They are being tasked to go too. We haven't got specific from here, but we have people all over who are volunteering to go out. So with that, I'll see if we have any questions from the...
So, sir, we're actually having some technical difficulties, so we have to apologize to our viewers for that. But we're still waiting for more questions to come in. But if I do have a question, though, it's for Major Marte here. So, sir, you're the public health emergency officer. What's a typical day like for you?
So, well, I still work on the civilian side. So usually I wake up around 4:30 to 5 in the morning. I do run every morning. It keeps me sane. And then I go over the numbers as of what happened overnight. Is there anything new from any of the agencies that we keep close eye on a daily basis? Is there anything happening in the hospital? And then if there's something major that Colonel Larson needs to know right away, then we keep touch. I touch base with him. He has an open door policy, and that's the first thing I do in the morning. Then after that, I see patients, and I always, the ASTS, I always get a phone call. If I'm not on base, early in the morning, I get a phone call from the ASTS with any new information that I need to be aware of. So if I'm on base, I'm taking care of the flyers, and there's always something to, there's always a flyer to be seen, or a case that we keep track of, and so on, and then multiple meetings.
And when you made a very good point there. So with regard to what we've asked people to do as far as reporting your condition for yourself and your families, those instances of people who have been exposed or who may be quarantined are given to our ASTS, and we have both Dr. Marte and Major Bubar, who are here all the time, who can reach out to those families, do a wellness check, answer any questions, do kind of that remote medical screening that we need for people who are out there. So that's why we ask you to report. And if you do have some sort of symptoms, or you're in a situation where you're being quarantined either because of your civilian job, we ask you to let us know so we can continue to help monitor and take care of you where we can. The other thing he brought up prompted me to remember, he runs every morning.
Yes.
And mental health is a big part of what we're going through right now. I know that last night on the After Cat, they talked about the increase in gun sales and alcohol through this whole crisis. And people's mental health is every bit as important as their physical health. And so today, hopefully by the end of the day, but you'll see coming out, I'm going to send out a commander directive and policy and authorize people who are at home to do the physical fitness leave that we would normally associate with here. I think I can do that within the guidelines of the regulations because I've assigned you your home as a workplace. So I would say, get out there and do some exercise. In your local area, go for a walk, go for a run, go out and back, kick the soccer ball around with your kids, whatever exercise is for you. I think it's important that we stay physically fit and mentally fit. And so you'll see some guidelines coming out today or tomorrow discussing what that is, but it'll probably be the normal LN fitness leave that you'll log on your time card. It'll give you those 3 hours per week that you can do physical fitness, which I encourage you to do regularly.
There's something Colonel Larson mentioned before, which is that we are not reactive, we are proactive. And I want to make the point, I want to emphasize that when you see at the gate the temperature check, and the question is actually preventing things from happening and protecting you and everyone on base from this condition or any other condition. So just keep that in mind, that this is once again being proactive and it's a preventive measure.
Perfect. Sir, so the next question, what can some of our members do? I know many of us were having to work in close proximity with each other, but what can members do to maybe stay safe or to minimize the risk of contacting COVID-19?
So first things first. Oh, well, also before I keep going, if you haven't noticed, I have a beautiful accent, and this mask doesn't make it easier. So I hope.
From New Jersey, right?
Yes, sir. So first thing first, right? So there's the DoD policy. If you can now maintain at least a 6 feet distance from each other, everyone must wear a mask, right? So like right now, Colonel Larson and myself, we have to wear the mask because of that reason. So that's number one, right? Number two, obviously, if there's someone that is sick, that there is suspected to have these conditions, or you must maintain that distance because it seems the virus, even though there are some reports showing that, actually 2 reports only, that it says that it can stay in the air. Usually this type of viruses do not, so that's why we are not certain whether or not that is the case, right? Obviously you have to clean the surface of that are used often, and if you are sick or feel sick, touch base, call your supervisor, and let him or her know that what's going on, and that person will provide further guidance.
Sir, now we've had some mobilizations here recently. Last week, do you think that we might expect any more mobilizations from ASTS or AES?
So the current thinking now is we've had a number of people raise their hand to volunteer, and what I need to caution everybody is those of you who have volunteered who are thinking about volunteering in the future, I need to make sure that you understand that we do not want to deplete the capabilities in our civilian community out there. So if you're someone who's providing that service and in the community right now, it's not, we do not expect you to volunteer and leave them void of that service out there. We had one member, not from our unit, but from another unit, who mobilized to go to New York, only to find out that the hospital they worked in New York needed them critically, and they were demobilized the next day and sent back, because military is not trying to deplete the resources of our civilians. As far as what's going on in the future, right now, most of the people, the reserves has mobilized roughly 125 people recently over the last weekend and sent them down to the tri-state area where they were oriented, and now they're serving in about 3 hospitals in the New York City, New Jersey area. The service as a whole, though, is looking at how we can even extend that more. Now, the Guard has been fully engaged for a long time, and this is part of their Title 32 duties as a state agency. But it's been a long time since we've used the reserves in this capacity. So the service is looking at possibly setting up even more medical field hospitals that you're seeing pop up, and looking for more forces to staff those. So you'll probably see there'll be a second round of requests for volunteers to staff some of these hospitals that they're looking at building in the areas where there's demand. Some of them may be in the tri-state area still, but it may go as this thing spreads to other areas of the country. One of the interesting things that is happening currently is there's actually probably going to be a request for forces from civil engineering to go down to Lackland, which is where the Air Force does its basic training, and to set up tents there, because they're trying to social distance all of those new entries down there, and because of that they need to expand their capacity. So there'll be a task to probably do something like that. There may even be a task to have to service those folks down there with our services folks. So there will be more volunteers. The other thing that's happening right now is with regard to transporting patients from one area where they might be able to get care in another, and that's where you're seeing our air evac squadrons being tagged to possibly provide forces there, and we have already had one call for those. Our group, or our wing, provided volunteers. They weren't selected in this round, but there will be a second round, so we will continue to see medical professionals needing to go out and take care of Americans.
Perfect. Well, that brings us to the end of our broadcast here. Again, I apologize. We're experiencing technical difficulties. However, as soon as this is over, I'll run back and make sure it's posted so that everyone has access to it. Gentlemen, before we leave, do we have any final thoughts or maybe some good news for the team here?
So I'd like to take a moment and just address a final thought. Early on when we started these, as we started to see questions come in, you can imagine that my public affairs officer over here is fielding questions and throwing me the softballs. But there was a question that came up that we discussed after one of our meetings that was posed by one of you that I think is a fair question. The question went something like, how long have you been preparing for this? And I think some people might have thought that might have been a snarky question, but as I've thought about it more and more, I think it's something that deserves an answer. If you're asking how long we as a wing have been preparing for this is part of contingency operations that we exercise routinely, where we exercise with our joint partners in the community, from hospitals to the paramedics to the police force on disaster exercises, and we've done that routinely. Our last one was late last year. With regard to planning for a pandemic, When you look at the base, every base is required to have a plan that outlines their continuity of operations. It's called a COOP plan. When you start looking at what would disrupt operations in this area, you can look at a couple things. Hurricane, maybe not so much. Tornadoes, not really likely, but possibly. Blizzard, storm in the Northeast, obviously. And the one that we really looked hard at was a pandemic. And this base published last fall, for the first time ever, our COOP plan. And that was the effort on a lot of people's coordination on the base. Colonel Cannon, Colonel Dugan, Colonel Enzer, a lot of people had hands in that, and it took a while, but we finally published it, and it was dealing with these kinds of things. So when it got to the point where we decided or we tried to determine what our level of continuity of operations would be, we went to the plan. We pulled out that plan. We said these are the kind of things that we need to keep going, and these are the number of people that we probably need to keep it going, and everybody else we restrict. So we've done that. We've assembled a great team of people. Every night I meet with them, and one of the things about leading a good group of people is you just have to give them the task, and they will solve it for you. So as far as that goes, I couldn't ask for any better people than I do. Every night when I talk to them, I'm just so grateful to be able to associate with them. Now, if you're asking me personally, my first question in anger would have been to say, all my damn life. But I would tell you this. For me personally, if you don't know me, I have a soft spot for my healthcare providers here. For 10 years, as a TR, I operated as a healthcare administrator, probably the third largest healthcare facility, nursing facility in the state of California. I know what it is to take care of people who are in a compromised state. Every year, when the flu comes through, we have to deal with that. It's surprising to me now that there's such a big emphasis on disinfecting and cleaning things, because when you work in that industry, that's the daily norm. But things that we're seeing people do now as far as disinfecting aircraft and workplaces, that's just the way we lived. So having had that experience, not only with the flu, but with H1N1, with MRSA that comes through periodically, we've dealt with that. I've dealt with the compromised. So I understand that. And as far as looking at people in hard situations, I get it. I mean, I lived in an environment where routinely I would have to look at my employees and say, guess what? The state of California hasn't signed their budget for the last 3 months. I can't pay you for the next 3 weeks. And you look at a single mother with kids who's making just a little bit more than minimum wage, that's not easy to do. And how to get them through that is not easy. And that's similar to what we do here. So for me, even though I'm not anything special, nor do I have any special qualifications, I do understand what we're going through, and I've seen some of it in small scale before. But I learned early on that it's not what I can do, it's the team that I put together, and all I have to do is be smart enough to listen to good advice. So this base is filled with great leaders and people who are doing great things. Early on when this happened, the fire department immediately began understanding that they are critical to our need here, and they self-isolated themselves and came up with a rotation that keeps them pretty much safe from getting this thing, in the idea that we needed to restrict some of their movement, and they've been sequestered in the firehouse for 3 weeks now. And other people, ops and maintenance, all across the community, people are taking proactive steps to make sure that we are ready for whatever comes through the gate. And so I think it's a fair question. I can tell you that I have never been more impressed with the leadership at AFRIC and at the Air Force level. There's some great people who are working endless, tireless hours to make things happen and cut through a lot of bureaucracy and red tape to get things done that actually I think in the long run will bode well for us as we go forward in understanding and making more efficient some of the things that we do all the time. So that would be my answer to that question. So in conclusion, I don't know. I'd just like to say that it's hard to say in a meaningful way to people sitting here that you really, really do understand how many people are giving everything they have, wherever they are, in whatever circumstances they are, to make things happen. But I appreciate what's going on. And I would just ask you to think about one thing. If I would have came to most of you about 3 months ago and said, you know what, I'm gonna have you stay home and work and allow you to have your families around you, and I'm going to give you a month or 5 weeks to do it, I think most of you would have said, wow, there's a lot I could get done there. There's a lot of good that I can do, and there's a lot of connection I can do with my family. But unfortunately, when you pile on that all the stress of having financial crisis or health issues or just the daily news, it detracts us sometimes from what our opportunities are. And I would say this, as a parent who sent 6 children out the door to college and has 1 left at home, having a teenager who's a senior in high school at home, who is forced by the conditions to stay at home with their dad or their mother, and it's put us in a unique position where I get a chance to connect with somebody who 2 months from now will be out of the house. And so I encourage you to take this time and look for the opportunities are there while dealing with the crisis there. I don't make light of the fact that we've got some serious situations, but I would say this: find ways to connect, rekindle an old relationship, start a hobby you always intended to do, take the time to be with your kids, exercise, do what you can for the work. I've tried to flex the schedule so you can do it when it's convenient, but there are things that come out of this that are good, and I've seen good things come out of the community. So I would encourage you to do those things as well. But thank you again for what you do. I appreciate being here. I will promise you this: I will give you all I can in the time that I have left. Hopefully tomorrow you may hear a big announcement on who my replacement is. I'm hoping to be able to do that. He or she may even be on the Facebook Live. I know that sometimes that individual's tracking us, so hopefully we'll be able to announce that tomorrow. Okay. Any other questions?
No, sir.
All right. Thank you very much. Have a good day.